I have a comment and a question. My comment is, in Maryland, there are senior centers that are free that have durable medical equipment from people who have donated it, and they have wheelchairs. They might have things like, well, they have walkers, they have the toilet seats. They might have that, what you had to purchase, the chair for the shower. I'm just saying it's a resource, and it's probably with Montgomery County. If you're in Montgomery County, you can avail yourself of that for free. Now, the question I have, and I don't mean to embarrass anyone, if you'd rather not say, that's fine. I wonder how you met Judy.
Nicole gave me her name, but I don't know how you found her. She, another counselor, another counselor suggested Judy when she.
Also, I'm privileged to accept Medicare, so once you know that I accept Medicare, my practice is pretty full. Some other questions or thoughts? Christian.
Yeah, Christian Sinclair, University of Kansas. We just heard a really good suggestion, and one of the things I'm struck by in trying to work with patients that I see in my palliative care clinic is they hear lots of good suggestions. I'm just wondering if you can talk about how many good suggestions you got that turned out to be sort of dead ends. Like, oh, you could do this or you could do that, but nothing ever happened with that, versus having someone who is very competent and knew exactly the straight path to go.
It just seemed like everyone did not know. They were all, everyone we were asking questions this was their job, the caseworker, and he didn't know. He asked us to do the spend down, save those receipts for 6 months, and make a list and send this in. And then he said, I don't know how the spend down works. And I guess from what I gathered, we were not going to get a check in the mail, though. It just meant that after 6 months, they realized that if you're using 75% of the income on medical expenses, that then you needed the extra Medicaid to help with the insurance. But we never got it. And when I searched online for Maryland's health department, it was very hard to find the specific information, like what was the income eligibility. What was the program like a spend down? There were, I do a lot of research, but I had a lot of trouble. And so you start feeling that it's just random if they're gonna award you this insurance or this grant or waiver. It's you start to take it very personal that they just don't want to talk to you anymore, and. So that's hard. I don't know.
It got to a point where they knew her voice and her name, and they wouldn't answer or call back.
That's how we felt.
Hi, Jeff Cohn. I'm a member of the Roundtable. Thank you for your stories. You've described a lot of challenges. Can you recall any examples of something surprising in a positive way that maybe happened during these 21 months? Something that maybe we can try and build off of?
I have to say that every time we met a caseworker or someone, they always, said that Andy needs these services, so don't worry, she's going to get them. And I believed it every month for 21 months. It was just dragging on so long. Everyone's very kind. You don't want to be angry with them or anything, but they, I don't know, it just didn't pan out.
And we do have to say they're an exceptional family, so their ability and resources, I think, is much, much more than average.
Yeah, we have
EMTs for Frank.
Frank's pneumonias come on very fast, and we're not prepared. He might just have a bad day of hard breathing, and then all of a sudden he's running a super high temperature, and he gets to be he's kind of, he doesn't know what's going on. He's getting delirious, and I'm asking him and trying to get him to go to the doctor maybe for a couple of hours, and I can't, and he can't do it, and he can't stand up. So then we had to call the ambulance twice in the last year. We as soon as you call them though it was 5 minutes. I'm not kidding. We had very quick response and very helpful, And then like they ask you for your list of the medications, and Frank's on like 12 things, and I forgot where the list was at the last time or whatever, and they just took the whole box of medicine and sat, and wrote them all down too. And they said, no, don't take these to the hospital. You might lose your pills. keep them here. But yeah, they were excellent. The EMT and the help we got at the hospital.
Did you want to share something, Frank? No?
No.
Marion?
I'm Marion Grant. I'm a policy consultant here in Washington, but in my previous life as an academic, I did research about online support for patients and their family caregivers. And I was struck listening to your story by the fact that you seem to be pretty tech savvy. And so on one hand, I think people in the healthcare world need to be aware of the wealth of information. So it sounds like you're in touch with other parents of a similar child around the world. That must be wonderful. How else would you meet these people given your crazy lives? But on the other hand, those wonderful resources aren't available for people who don't have access to the internet or who aren't good with technology. And I just wondered if you had any thoughts about advice you would give or things that we could do better in terms of providing online or internet support.
I don't know. I remember when Andy was born, and then we were there in the hospital, and at birth they knew she was going to have multiple problems. She had a heart problem. She had a cleft palate. She had the extra finger, and she had webbed toes, so they knew from the beginning that she was some genetic syndrome. They didn't find out what, but they just sent us home from the hospital with her in 7 days, and she was on nasal gastric feedings and things like that. And Frank, I couldn't do it, but Frank was able to insert the NG tube. So, but anyway, what I'm thinking is that I said back then that I want to go back, and they need like another parent in the hospital when they're hit with these things. A parent that would come in and say, we've been through this, and this is what this is what you need to do. This is what you need to do. I go back to in Michigan. What it was though was we didn't even know about early intervention. But at 1 year of age, someone through our church directed us and said, she could be in that. And school with that school social worker, school nurse is where we learned everything, from age three on when she was going there. Yes, I don't know. There's got to be a way that we can, reach more people, and it probably has to start with your doctor's office, because everyone has to go into the doctors, and maybe I know our doctor's offices now do have social workers too, and actually Andy's doctors are wonderful, and they had an office social worker, and actually I talked to her a couple of times, and when she did some research, and she said, there really isn't very much available for parents of adults with serious problems. There isn't much available, and we didn't get too much help, but we do need someone to coordinate things. Yeah, I don't know how to get the word out there. Yeah.
Thank you. On this side.
I'm Türkan Gardiner, applied statistician. My question at this point, because I didn't hear from her, is from Nicole. Evidently, you provided and did some reconfiguration of your own household for an in-law suite to accommodate and be a hostess to your family, which is very admirable. But how did you coordinate your end of the story? Your own immediate household? Did you get any support from the neighboring, for example, Visiting Nurses Association or home health aid assistance? For example, I do remember a short time when my mother-in-law moved in with us after having hip surgery from Maine. And we had a lot of people coming into our household offering bath service because I myself was working at that time, and then put us into contact with home health aides who'd come into our household temporarily. This wasn't a long-term situation, but I'd like to hear from you, being such a wonderful caregiver yourself.
Well, yeah, thank you for the question. I'm a builder. I was a policy person and I have a PhD, but I made a shift in my career and now I do green and modern single family homes. So we had a great advantage here when I knew my parents were going to need some extra help. So we redesigned, we bought a mid-century home in Bethesda, completely redesigned and gutted it, and then added on 2 new wings. I wanted to make sure that they weren't going to go in a basement, like so many in-law suites end up in the basement. So we built a house on piers that it's, easily accessible from the driveway and, from the road. But it is interesting, some of the challenges that you come across, the neighbors were some of them were difficult. They didn't want an extra, house too close to their property line, or there's an architectural review committee in my neighborhood. We had to go to 6 meetings over 7 months to get approved. Some things like that. And then I did find out that Montgomery County offers a $10,000 tax credit for these kinds of changes to your home. But, like my mom was saying, you have to have front door access. And on my property, it makes much more sense to access from the driveway we have a courtyard and we have 4 other doors, but those don't count. So stuff like that, it's still very frustrating. Even with all the resources that I have, it is very, very frustrating to get the job done. Yeah.
Thank you. Thank you very much. We have time, I think, for one more question.
Thanks, Judy. Joanne Reif Snyder. I'm also a member of the Roundtable, and thank you so much for sharing your story with us today and grounding us in what really matters and what we want to talk about today. Since our topic is integrating healthcare and social services, you've really set us on an interesting path because you really were the care manager, sort of bringing together your healthcare and social services. Can you comment on Andy's healthcare providers, physicians or others, and how involved were they with any support that you needed for establishing the social services, and are they involved now? What does that look like?
As far as social services, no, the doctor just never mentioned that. They have been wonderful. I mean, when I go in, they've been a little bit of a counselor to me when I go in and to talk about Andy's problems. The doctor will take extra time and listen to you, and they're very good at filling out all these papers. For all of these applications, we'd have to come back to the doctor's office and have another health form signed by them. Make sure that Andy was up to date on all her, TB skin test and this and that, and they've always been real helpful there. But I don't think they don't think about referring you to the social worker enough. Even like I said, even though they had one in the office. I think it took quite a few months before someone suggested that. And I think that was the person at the front desk instead of the doctor. It was the reception. Mm-hmm.
Well, thank you very much.
Judy, the last lady that said that about, we were answering the question with Nicole, but we didn't answer her question about the home care. When we moved here, the home care and those kind of things, you have to have been a patient in the hospital. And then it's automatic. But if it wasn't a hospitalization, like when we just moved and they have chronic conditions, you didn't apply. And even when we first got the Medicaid number in February for Andy, I right away called a nursing service and asked, this is Andy's Medicaid number. Can you provide in-home care? And she said, your Medicaid doesn't pay for that. And so then we had to call, Medicaid back again. And this time, instead of talking to my caseworker, though, we called the main office for the state Medicaid office. And then they referred you to a person that said, we have to send a nurse out to evaluate you again. And then it was another referral to get the special services. But you wouldn't qualify just with your insurance unless you had a reason like a hospital visit or something.
Well, thank you. And I think the whole audience and people outside of here would be agreeing with me that this is a real privilege that you all shared your story with us. And it truly takes a village, as we can see. I'm really touched and heartened by all the hard work you've done.
Thank you, Judy, and thank you to the whole group for doing this, for talking about this. We need to talk about it more.
Thank you. Thank you so much, please. And Marianne, Frank, Andy, and Nicole will be with us through lunch. But while we leave the stage, I'd like to welcome Lynn and Robin and Lauren to really come and help give us some of the data and facts behind the story we've just heard.